I'd like to bring on the program Marcia, Otto, Vice President of Pricing and Transparency Applications with Health Advocate, a subsidiary of West. Marcia, good morning.
Good morning.
Hey, you're coming to us bright and early from San Francisco. Nice to have you here.
Oh, no problem. 8:10 in the morning is not too early, but yes, thank you. It's great to be here.
Yeah. Hey, give us a little background on what you're doing there around price transparency with Health Advocate, and then we'll kind of jump into some of these questions too.
So, yeah, sorry, I've got allergies here. Health Advocate, just a quick little background, is the nation's largest healthcare advocacy and assistance company, and our core business is really around our award-winning health advocacy program that helps members navigate complex health insurance-related issues. And we have a bunch of other complementary solutions as well, like wellness, EAP, chronic care solutions, et cetera. And we also leverage data that we get from our self-funded clients to create a pricing transparency solution. We also have personalized health communications, all this to help the member make more informed decisions and get more value out of the healthcare system. So where pricing transparency comes in, we already have a lot of, with our core advocacy program, we already have a lot of touch points with the membership who are calling in for a variety of reasons. Mm-hmm. We built from this data our own pricing transparency solution so we could help support them when they're calling in, because we noticed that many people were calling in asking about questions with their high deductible plans. And so we built a tool, but what really, frankly, it's very on par with what's out there in the competition, a tool to be able to look up prices for medical procedures and find out how much it's going to cost them out of pocket based on their benefits today, and then to see quality information side by side so that the member can make the best value-based decision. And so that's what Health Advocate's been doing, but what we really do is we tie it with our advocacy to have the human touch for those that want to schedule the appointment or they've narrowed down their choices. Those who want to do self-service can do self-service, and those who don't can still call an advocate. Or for those who are calling in for other reasons, we try to steer the conversation towards pricing transparency. It's a long
and that
answer.
Makes a lot of sense because people need a lot of help, don't they? I mean, people really need help, and some people can go to self-service and be okay with that. Others need a little hand-holding to be guided to where they need to go.
That's exactly right. You're on my team here. You're hired.
Yeah. Hey, Marcia, talk a little bit about, where you've seen, price transparency change since it really first emerged in this space.
Yeah, so I have actually been focused on pricing transparency and provider transparency tools since early 2007. So I've actually been around since it's been really its birth in a way. Originally, a lot of payers were terrified of providing this information for fear that the market, other providers would compare their costs with the other, saying, "Hey, look at that guy's getting paid more," and it would really kill their what differentiated them with their negotiating power. And there were lawsuits, and when I worked for Blue Shield years ago, Blue Shield even wanted to show quality information on providers and had this blue ribbon thing, and they got sued. And throughout the years, it's all worked itself out, and now every single payer is offering a pricing transparency tool, and it hasn't really changed the market. Unfortunately, it hasn't even changed it enough to there's still differentiators out there, and what they feared was going to happen did not happen. They would all say, well, look what this person's getting paid. I want to get paid that as well. So it's definitely now the norm, and it's accepted, and there's a lot of vendors out in the space, and a lot of employers are very interested in this. What really makes it, what's really changed since the early days is the need for it is growing and growing. And, I'm preaching to the choir here, but everyone knows, that the incredible growth with the high deductible plans. Kaiser Family Foundation says kind of all firms as of 2015, 46% of them are in high deductible plans of over $1,000 or more deductible, and those are growing and growing. So no one gets, which I had 2 years ago and I missed dearly, the $250 deductible family deductible plans that that don't give anybody any skin in the game to make these cost decisions. Out-of-pocket costs are, since these high deductible plans are out there, the out-of-pocket costs are skyrocketing. They say it's growing 68% in the last 5 years, mostly because of the high deductible plan. So people are going, there's interest and more need for it. There was just still a huge hurdle over education.
Yep. What do you see? You kind of alluded to some of the benefits. Maybe we can just talk a little bit about that, some more of the benefits of healthcare price transparency, because I want to get into this engagement and education. I think that's a key industry pain point that needs to be solved. But what are some of the benefits of healthcare price transparency and the corresponding tools and resources that you see?
Well, the benefits are a couple-fold. The first the first benefit is to the employer. The employer is moving their employees to these high deductible plans, thus putting more of the onus, financial responsibility on the member. And so the member, the employee is looking to the employer to give them tools to deal with these new plans. And then, of course, the biggest benefit is to the member who's got to pay these huge out-of-pocket amounts. And so if they are getting a MRI and they've got a $3,000 deductible, they would want to find one that maybe was $400 instead of a $2,000 one at a hospital. So trying to understand that imaging centers is a big educational point. So that's the real benefit, and hopefully, and employers are also hoping that by having their employees go to lower priced providers, could also help lower their medical expenses. If a member saw that hospital A cost $42,000 for a knee replacement and hospital B cost, on average, $60,000, even though maybe their out-of-pocket might have been maximized, their out-of-pocket maximum had been met, at least they could say, wow, this place, there is good quality places for lower prices, and if I go to the more expensive one, this may impact my employer next year with higher cost medical plans.
So, go ahead. I'm sorry, Marcia. Go ahead.
No, that's it. Sorry. That's it. I was just pausing.
So a lot of this is pretty logical, and for why employees and their families should be using these tools. So why do you think they're not using them more?
That is that's a great question, and right. So the huge buzz. Everybody wants pricing transparency, but if you build it, will they come? And there's been a number of articles, just even the last few months, the one in JAMA, that talked about how there's maybe 10% utilization, or even one a couple of years ago from who was it? That only 2% of members have been using these cost tools, and while 90% of the health plans even offer them. The Catalyst Payment for Reform did that one. So there is low utilization. So what is really driving this? I mean, I think the first thing is that people don't even understand, they are not yet, even though they have a need for it because they're on high deductible plans, they don't even understand what to do about it. The Public Agenda, March of last year, did a study that showed that 57% of Americans do not even understand that some doctors, even within their own insurance plans network, may charge more than others for the same services. And I quote that all the time because it's so powerful. It's like people don't even get that there's price differences. So maybe they're carrying a huger burden, but they don't even know that there's something they can do about it.
Go ahead. I was going to ask you. I was going to interject something here just to get your perspective because you live and breathe this. And some of this, though, Marcia, doesn't it make sense why they're not engaged yet and why they're not using it? I mean, because, we're moving to a shared responsibility environment with high deductibles, et cetera, and more consumer choice. But we're moving from an entitlement, type of program, so they didn't have to think about these things, correct? So it makes sense that they don't know. They don't know, and people don't like to change. And even though they've been forced to change with maybe different plans out there, it's going to take a while to catch up, is it not?
It is. Yeah, education is the biggest hurdle. So, even the research is showing that people are holding off on all medical care, including preventive care, because they're just like, oh, it costs too much, not knowing, just not even understanding everything. And, so education is the biggest hurdle. If you build a tool, will they come? No, because people don't even understand about it. So right. I think the biggest problem is how long it's going to take for people to understand this. And that's, that's what Health Advocate feels like one of the things it does that's really unique is we have people to talk to, and we start this conversation. If someone's calling in about a knee issue, we're going to say, are you getting an MRI? Have you considered how much, have you considered looking at prices? Let me help you do that. So there needs to be somebody steering the conversation, as well as the employer. If they purchase a tool like ours or some others and just send one little note in their, in the benefit, the enrollment guide, well, guess what? Someone is not going to do anything about it. So, there's a lot of talk in the marketplace. The first step one is awareness, and then step two is doing things to really drive change and or savings. And of course, a lot of companies are talking incentives. Incentivize them the first time, just get them to even use the tool, so that maybe by the next time that they might actually have something that they will remember that tool and then use it. Honeywell, there's just an article that came out that said that they switched from an incentive to a penalty and had tremendous four times savings results with no impact on employee satisfaction. They picked a number of surgeries or imaging, I think it was a couple of surgeries, and said if you don't call this service that we have before you get it done, you are going to pay a penalty of $1,000. And their employees were actually fine with it and did it, and then they found savings that way. So there's got to be ways, and then there's the whole concept of reference-based pricing. I think that's one of the more powerful ways to also drive people. Really make it clear that if they, give them a tool, and then give them something that's really going to make them put even more skin in the game, that they're going to pay even more out of pocket beyond a ceiling price for a procedure, then it's going to drive utilization.
Yeah, that makes a lot of sense, and I like your model too. I mean, people want to talk to people still. People need to be taken somewhere, and then once they become comfortable with it, then they'll use the tools. I mean, people need to have multiple ways. I mean, millennials might go right to the self-service tool and be okay with it, right? But while people like myself might need a little hand-holding.
It's complicated. I mean, if the average person can't even understand what the word deductible even means, all of us are so in tune with it. We know what deductible, copay, and coinsurance, but it's not understandable in how it's applied and how you got to meet your deductible first, and then you might have copay, and then coinsurance kicks in at a certain percentage after. It's all completely complicated for the average, for even more than the average person, for most people out there who are not working in the healthcare industry. Yeah.
Talk a little bit, if you would, Marcia. We got probably about 3-4 minutes here left, but talk a little bit about how transparency can be better integrated with, other employee benefits and programs.
Well, I was mentioning, they've got to have skin in the game. So, if they have a low deductible plan, they're not going to be driven to do it. So, there's some thought that they need to have some cost sharing in there, else there's going to be the lack of incentive to shop. There is, they could just change their benefit design to be less on just copays and more on coinsurance at some certain point. And then I mentioned that CalPERS, or the example of reference-based pricing, that's something I think is going to grow, and according to some Aon Hewitt study, that 53% of companies are considering it for the future, while 6% are doing it now. People could Google this if they want to learn more, but CalPERS not only save their employees by setting a ceiling of $30,000 for hip and knee replacements, they save them $300,000 one year, but they also save themselves $2.8 million in medical costs, and then they drove the cost of health care down by, before they went with this reference-based pricing in California, there were 46 hospitals that did it for the ceiling amount, and then a couple of years later, 72 hospitals did it for the ceiling or below amount. So there are ways to drive, reducing costs and drive people to these tools, as well as incentives and possibly even sticks out there in the marketplace to get them to understand there are ways that they can help themselves with lowering their out-of-pocket costs and help their employer by lowering medical costs overall.
Yeah, sounds good. So what's next as we kind of come to the end of the pro? What's next for pricing transparency?
I think what's next, has it changed dramatically in the last 7 years? Not necessarily. I think just what's next is more and more people just becoming aware of it, and making and it's going to be probably bundled in with a whole bunch of other things that their employees are doing. There's a big movement lately with taking all the benefits that an employer offers their employee and putting it in one place and driving them and helping proactively engaging them to use these tools to get better benefit out of them.
Yeah, makes sense. Hey, this has been great having you on the program, Marcia. I'd like to give you an opportunity to leave our audience with some key takeaways, if you would, please.
Sure. Pricing transparency, while it has not shown to have great utilization yet, there's no one out there, any of the analysts, thinking that it's the tools problem. It's really all about the education problem. There is a great need for it to bring that education to the forefront, for a member to understand how to actually shop for care like they do for many other things. So I think you're still going to be hearing about it again and again, and I think it has a great future. And there's even tools being built out there. Health Advocate's going to launch one as well for helping people understand their pharmacy spend, as well as even dental spend. So there's going to be a lot more movement towards shopping away from the traditional model of all you can eat, health care for whatever you want and see whatever provider you want. I think it's still going to be around, and companies like Health Advocate who could help walk the person through this and help them understand it will move that forward faster.
And they can find information on this at Health Advocate's site, right? healthadvocate.com, correct?
Yes, healthadvocate.com, or they could send me an email, motto@healthadvocate.com, if they have any further questions.
Thanks, Marcia, so much. You have a great Labor Day weekend, and we'll talk to you again soon.
All right, thank you.